certainly take other surgeries that are more medically necessary, but this is still surgery.
Recovery Q&A. We have all your questions answered here on Lipstick and Lipo. I'm Dr. Ashley Amalfi, board-certified plastic surgeon, here with my good friend and co-host, Dr. Smita Ramanadham, also board-certified plastic surgeon. Hi, Ben.
Hi. Hi,
We are
guys.
we are diving in, you guys. We did a whole series answering all your breast Q&A, and now we are putting all your recovery questions together. You guys love these detailed questions because we're getting so much deeper into the nitty gritty than we do when we're just trying to teach you stuff. So
Yeah.
keep asking.
Probably a dumb time frame, but got to work with what I got. I have a very sedentary office job. Is it feasible to go back to work in 7 to 10 days, trying to get as much information as I can before I make this big decision?
Interesting.
Okay.
Well, we
Yes.
don't know what surgery they're having.
Yes. Obviously,
So
well,
yeah, it's not that crazy though, right? I would say if you're having a breast surgery, a week off from a sedentary job is literally all you need. That's plenty. You'll be absolutely fine. Some people push that even more and go back after a handful of days or a day in a long weekend.
week, like more than what you actually need,
Yeah,
depending on
isn't
how
that wild?
you Yeah.
So, especially for what you said, like a sedentary job, like if you're sitting at a desk, you're not lifting anything, you work from home, amen. Like after breast surgery, quick. Tummy tuck, I don't know. What do you think about a tummy tuck? I think a week is actually for some patients kind of doable. And I
Yeah.
think 2 weeks for most after a tummy tuck.
I agree. I think a lot of it depends. I mean, listen, everybody has like a different threshold for pain. There's again a gradient in if we're doing a lot of liposuction, if you have a big muscle repair that we're doing, if
Yeah.
we're doing like a fleur de lis instead of a traditional tummy tuck or an extended or there's so many variants,
Yeah.
but
More is more.
more is going to be more, and more
Yeah.
just means you need a little bit more time off to fully recover. But yeah, if you have a desk job, if you have the opportunity to work from home, um, 2 weeks is pretty good. I think if you have more of that active job where you're going to be walking around, moving around, then you definitely want to take off as much time as you can
Yeah.
to fully recover, so that you don't have any hiccups in your healing process.
Yep, I agree. That one is a little closer to 3. So it depends. It depends on how tough you are. It depends on how important it is to get back to work
Yeah.
too. Sometimes it is all you have, and is the first week back to work gonna suck? Yeah, but sometimes weeks
Yeah.
at work. Yeah.
Yeah.
Mhm.
You'll
But
get
you
through
can
it.
do it. You'll get
Yeah,
through it.
you'll get through it. Okay, so next question.
Okay, I
I'm
love it. Asking me, I don't even have to open.
we're just on a go. Yeah. I'm sore after 2 weeks, and the doctors and nurses say it's normal. So again, we don't know the surgery that this person had,
I
but
would say no matter what I did to you, if you're sore 2 weeks, yeah, that's normal. Yeah, I
normal.
mean, this is for honestly anything.
Yeah.
The soreness, I mean, this is surgery, you guys. Technically,
Guys, this is surgery. Like there's a process that we have
yeah,
to.
a year-long process. So this is 14 days. And as things are fresh at 14 days, I mean, I would say things that feel different or off for an entire year is normal. So definitely at 2 weeks, I would anticipate it would be shocking to me if you were not sore in some way or that something,
Yeah.
nothing is going to feel totally normal that rapidly. I mean, even if you have the flu, you don't
Yeah.
feel better and totally normal at 2 weeks.
Yeah. I mean, even after like a little neck lipo, right? Like you're still going to feel a little soreness there. So, um, give yourselves grace. Let yourselves recover. This is surgery. I think this is often like the little, like hole we get ourselves into where we think it's cosmetic surgery. It's not as,
Yeah.
dangerous or, not as,
Invasive or, yeah.
invasive, or we just take it a little bit lighter than we would certainly take other surgeries that are more medically necessary. But this is still surgery. You
Yeah.
still need time to recover. Your body, I tell my patients, like, even when you go back to your normal things, when you feel like you have enough energy, you're going to be fatigued faster. And it's because your body is using all this energy to heal.
Yeah.
It's like running a marathon or ultra marathon and having to recover from that. Your body needs to recover. So just be patient,
Mm.
talk to your
Even if
doctors,
you
talk.
have, like, a cold,
Yeah.
like, even if you're sick and, like, you can't go to work because 'cause you're sick because you have, like, a virus or something, when you go back to work and you're not sick, like, you're still a little run down. Like, your body just needs time to heal itself, and surgery is, an insult to your body, not just to the area that we operate on, but, your whole body is healing, and so um,
Yeah.
the one thing you said, like, after liposuction, like, you'd still be sore. Liposuction makes you sore for a really long time. And I think the initial pain from liposuction is like acute and whatever and normal, but like that lingering pain is really normal. Or when we do breast surgery, like, as the nerves are regrowing and stuff, like, you still have like little zingers. So
For
there's
months.
for months. Like, so throughout the first year, like, and mostly in the first 6 months, there's like little reminders that this is an actively healing surgical site. They're not going to ruin your day. They're not going to ruin your job. You're not going to not be able to work out. But like, there are little reminders that this part of your body is still healing. And honestly, maybe reminders that we need not to like
Yeah, I was
overdo
gonna
it.
say they're good reminders, right? Because sometimes we forget.
But like quickly, especially after breast surgery, like you instantly forget that there's like that a lot going on. And so, yeah, your body's telling you to chill out, sister.
Slow down, just slow
Yeah.
down and give it some time.
Mhm.
All right, so we have a lot more questions to go through. I think we're gonna come
Yeah.
back too,
Let's do it.
obviously. So,
Yeah.
guys, thanks for watching. Come back next week. We're gonna go through the rest of the recovery questions and answer them.
Dive
So don't
in.
forget to subscribe. We're on YouTube, we're on Apple, and on Spotify. And leave us your comments, ask more questions. This is really our time to connect with you guys and dive deep.
All right. We'll see you soon. See you next week, guys. Bye,
Bye.
Smita.